Demystifying the DSM. This is a series where I am going through literally page by page of the DSM-5 and kind of sharing my personal and professional experience around these diagnoses. So this can be for lay people, but it can also be for professionals to kind of try to wrap our head around what this diagnosis actually entails. I am now going into the Somatic Symptoms and Related Disorders chapter. I'm Cristi Bundukamara, Psychiatric Nurse Practitioner. I have over 20 years of clinical experience, but I've also been through some pretty significant hardships and have had to do a lot of self-work on myself, so that is often brought into these teachings. So today we're going to talk about somatic symptom disorder. So there's 5 somatic disorders in this whole chapter. And today I'm going to be talking about the somatic symptom disorder. This is kind of that general thing. For many years, we talked about somatic disorders being kind of all in your head, that there was no physical reason for you to have that symptom. The DSM-5 has gotten away from that a little bit, especially as we learn more about just medical things and how psychologically that our mental health symptoms can actually present in real physical changes, including changes in lab work. I was recently sharing in my grief series that I have lost 3 children and something is physically going on with me right now. I have inflammatory markers are elevated and things like that. And so there could actually be physical things going on, even in these somatic symptom disorders. So that's important. Oftentimes that's the first indication when somebody comes to the primary care, emergency room, urgent care. This is where we see a lot of these somatic symptom disorders, because if that is the isolated disorder, they likely are not seeking psychiatry first. They might seek psychiatry after several visits to their primary care, urgent care, maybe seeing a couple specialists and everything coming back normal, okay, as far as like objective testing. But it was important that we differentiate this in the DSM-5, that that's not specifically a criteria. That is often what gets us to start thinking about, is this a somatic disorder? But it is not a criteria. So if you've been following me on this demystifying the DSM, all DSM have criteria, A, B, C, D, sometimes E and F, and you need to meet that criteria in order to receive the diagnosis. So if I were to go and tell the doctor, I have headaches, I have headaches, I have headaches, and my test results are coming back normal, that does not mean that I have a somatic disorder, okay? What the criteria is that the A criteria is that you have one or more symptoms, physical symptoms, that are resulting in significant impairment. So for some people, pain is a significant impairment, but there's causing some sort of significant impairment. It's not like, oh, I have a headache, every afternoon and, I'm trying to drink more water, like that is kind of a normal response. Remember, these are mental illness type disorders. And so this symptom is causing a significant impairment. Plus, so this is criteria B, there has to be abnormal thoughts and feelings and even behaviors around this symptom, okay? So all of us can have kind of aches and pains, symptoms we don't understand what they are, can't be explained, maybe even things like stress headaches, you know where it comes from, right? But your thoughts, your feelings, and your behaviors are not abnormal around that you are working through or, trying to take better care of yourself or, explaining through that, okay? But an abnormal thought, feeling, behavior is like it's disproportionate to what's going on, it's persistent. So they have to have one of these 3 things. There's either a persistent, disproportionate idea of how serious it is, right? Like I have a headache every day and therefore I have a tumor and I'm dying, right? That would be a disproportionate, I got an MRI, I have no tumor, but I still believe it doesn't matter if the test results are coming back negative. So so that's one of, we're still in criteria B. There's a high level of anxiety around the symptom. Like it's just constantly there and very anxious about it. The third is that there's excessive time and energy spent around those abnormal thoughts, feelings, and behaviors, right? I could have an abnormal test result and be like, oh my gosh, I hope it's not cancer. But I can let that go until I get the results. And when the results say I don't have cancer, I feel good, right? I believe those results. Somebody with somatic symptoms, they have, in this criteria B, they have one of these three, either disproportionate, persistent about the seriousness of it, a high level of anxiety around it, or excessive time and energy. And we measure this in mild, moderate, and severe. And so mild would be, I have one symptom and one of criteria B. That would be a mild case of somatic symptoms. A moderate case would be two or more of these criteria in B, but maybe only one symptom. Severe would be more than one symptom, two or more symptoms, plus two or more of the criteria within the criteria B. Okay, so, and then the criteria C is that this is persistent. This is not just, something that's come to the surface and you're really worried about it for a month or two. And then once all of your tests are back, you can kind of get back to normal. This is closer to like 6 months of, really being kind of honed in, ruminating on these thoughts, having a lot of abnormal thoughts, feelings, and behaviors around this physical symptom. Okay. So we no longer say it's not a medical, a medical has to have been ruled out, right? That is definitely something that we talk about. That's a red flag for us to evaluate whether this is a somatic symptom disorder, but is not a criteria, because we do have to be careful with that. Medicine is always evolving. There was a time when we, didn't have objective testing for, autoimmune disorders and things like that. And so there is room for continuing to kind of test to make sure that there isn't also a medical underlying condition, right? But somatic symptom disorder it's really more about not just the symptom that we can't explain medically, but about how they're responding or reacting to that. Is it disproportionate to the symptom? Is it persistent? Is it super high level of anxiety around it? And is there too much time and energy being spent into this symptom, this symptom, this symptom? So that is somatic symptom disorder. Continue to follow through this chapter and through the DSM, demystifying the DSM, as we put these things into, diagnostic criteria, but also clinically. Oftentimes in my practice, we don't see this by itself. We see this in combination with an anxiety disorder, or in combination with depression, definitely with psychotic disorders. We see some somatic symptoms. So also looking at those comorbid pieces and making sure that we are treating those. So there's not a specific treatment for somatic symptom disorder. Cognitive behavioral therapy is always the place to start. If we change the way we think, we can change our behavior, right? And this is all about those abnormal thoughts and feelings. But also medication in treating kind of depression and anxiety. This is definitely anxiety. We use antidepressants as a first-line treatment for anxiety, so that would be something to consider. So even though there's not specific medications for some of these not as common diagnoses, it doesn't mean there's not things there that we can use to treat, right? We know that low neurotransmission causes depression and anxiety. this is very much an anxious type disorder. And so let's treat it like we would treat anxiety if it's, even if it's by itself. Okay. So, and then that cognitive behavioral reprogramming, cognitive restructuring around, the time and energy. I think about a choice opportunity that we have around anxiety, and it's like, it's a scale of 0 to 10. And how much energy are you wasting on these thoughts? And, maybe they give it an 8 or 10 in the beginning, and the goal is to get them, less than 5 or less than 4, so that there is, like an attainable goal, but not this kind of all or nothing, right? Anxiety is more of a continuum than getting rid of it altogether. So that is somatic symptom disorder, how we would diagnose it, how we would treat it, and continue to follow. If you got to the end of the video, you obviously enjoyed some of the content. I have a lot of free content out there. I am really trying to empower everyone to find their mental strength. So subscribe, get the actual notifications, and let's embrace this journey of mental strength. See you there.